My name is Sarmila Triponisvara, and on behalf of the committee, I would like to welcome everyone presented today to Instructional Video Competition Animal Bite and Stings 2.0 2023. In collaboration with Remote Envenomation Consultancy Services, Malaysian Society on Toxinology, College of Emergency Physicians Special Interest Group, Emergency Medicine Student Association, National Poison Center and Malaysian Association of Medical Assistants, Persatuan Mahasiswa Siswi Fakulti Perubatan UKM, Persatuan Penolong Pegawai Perubatan Malaysia, and Kesatuan Pembantu Perubatan Malaysia. This instructional video competition consists of a number of topics which includes pressure bandaging and immobilization, hot water immersion, eye irrigation for venom ophthalmia, first aid for jellyfish stings, first aid for arthropods bites or stings, first aid for snake bites, anti-venom preparation and administration, documentation and serial observation following a bite and sting incident, rate of proximal progression, and ultrasonography for snake bite and venomation. Participants are welcome to choose any topics above and come up with an instructional video, as long as it is within the opposed rules and regulations. There were only 2 simple rules for our competition today. Each group should consist of 3 to 5 persons. The time frame for each instructional video is limited to maximum of 5 minutes. Participants' instructional video will be judged based on creativity, showmanship, content delivery, and accuracy of knowledge. Cash prize is awaiting for all the winners. Now, let me introduce to the honorable judges for our today's competition. Puan Sazroni Muhammad Rashid from National Poison Center, USM Penang, Dr. Patrick Joseph Tiglo from University of Philippines, and Dr. Muhammad Shukridin bin Saleh from Hospital Kuala Krai, Kelantan. Thank you all for the contribution in order to make it happen today. We committee members are proud to be a part of our IVC. Next, I would like to warmly welcome Professor Madhya Dr. Jemima Che Hamza, Deputy Dean of Undergraduate, for our opening speech. Welcome, Doctor.
Okay. Assalamualaikum and a very good afternoon. Thank you very much for the invitation. So before I actually go on, I would like to welcome Prof. Madhya, Dr. Ahmad Khalvin Ismail, Program Advisor for the Instructional Video Competition, Animal Bites and Stings 2.0, invited panel judges for the competition, Madam Zaza Rahim Mat Rashid from University Science Malaysia, Dr. Patrick Joseph Tirdo from University of the Philippines, and Dr. Muhammad Shukridin bin Saleh from Hospital Sultan Ismail Petra. Putri Nur Aisyah binti Abdul Samad, representative of Persia, the Student Association of Faculty of Medicine, UKM, and ladies and gentlemen. First of all, thank you for His abundant grace that we are gathered here for the instructional video competition Animal Bites and Stings 2.0. I, on behalf of UKM Faculty of Medicine, express my sincere congratulations and appreciation to all the participants for attending this program. Many types of animals can inflict bites on adults and children. This injury, if not treated, may cause infection to the love area or carry diseases that can be transmitted systemically through a bite. So this program is actually organized by Persia, our Faculty Medicine Student Association, with several collaboration of very esteemed bodies, which is illustrated by our MC just now. It aims to provide exposure to participants about the field of clinical toxicology as well as pre-hospital care in emergency setting in event of animal bites and stings. Ladies and gentlemen, for your information, this program has exceeded the targeted participants from all over the world, which is an incredible achievement. But I'm not so sure how many actually, because I didn't have that information. But I would like to take this opportunity to thank everyone who's involved in this program. So well done to the entire organizing committee for their dedication to making the program a success. I hope the participant will enjoy this program as well as the committee which enjoyed preparing for it. I wish you all the best for today and may you benefit from this program and will be able to apply the knowledge you obtain in this field. As Brian Tracy say, be a lifelong student. The more you learn, the more you earn, and the more self-confidence you will have. Finally, with Bismillahirrahmanirrahim, I officiate the instructional video competition, Animal Bites and Sting 2.0. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Thank you very much and have a great program.
Thank you so much, Prof. We are glad you could make it today. Without further ado, let us straight jump into today's agenda. Today's first instructional video is by group Pink Venom, consists of 4 members, Anis Adiba binti Adnan, Alia Amira binti Sirajuddin, Atira binti Azman, and Adriana Nadia binti Muhammad Rizal from University Science Malaysia with the topic of first aid for snake bite. Thank you and all the very best to the whole team of Pink Venom. Moving on to the next video presentation. Next video will be by the Warriors, consists of 3 members, Muhammad Yusri bin Idris, Ahmad Shahimi bin Ahmad Sabadin, and one Nur Alia Shamimi, one Muhammad Shamiruddin from Trauma and Emergency Department, Hospital Sultan Abdul Halim, with the topic of first aid for jellyfish sting.
This is instructional video on how to do first aid for jellyfish stings. Jellyfish stings are a frequent occurrence in many coastal regions across the Western Pacific and adjacent areas, with death and severe envenomation being reported over the year. The characteristics or distinguishing features of jellyfish stings will depend on the type of jellyfish that a person is in contact with. Some may cause significant injuries that may present as pain, swelling, skin lesion, blisters, and rashes that may persist for days or weeks, and there are those that only last for a short duration, which is less than 24 hours. Some severe cases of envenoming may result in chronic issues, morbidity, and even death, mortality. Harmful jellyfish stings can be caused by box jellyfishes like Caranax flaccari, blue bottle jellyfish like hydroswans, or other jellyfishes like siphozoans. Not many people understand the exact first aid method to deal with jellyfish stings, especially from venomous type. This video serves to promote prompt and proper first aid following jellyfish sting that may help to minimize the risk of severe envenomation. First, ensure safety at the scene. The priority in the early intervention of jellyfish stings is to secure the safety of both the victim and the rescuer or the first aid responder. Make sure that the rescuer is safe from being stung by the jellyfish. Move the victim out of the water. Place the victim flat and calm the victim. Call for help. Do not panic and leave the victim alone. Early intervention. The intention is to decrease venom exposure as early as possible and provide a reasonable measure of analgesia en route to the medical facility. Method: inactivation of undischarged or discharging of remaining inactivated nematocysts by vinegar, seawater flush, and cautious physical removal of tentacles by using forceps after vinegar has been poured and by a healthcare expert. Do not use your bare hand or mouth to remove the tentacles. Lidocaine spray or either hot with caution or cold application. En route to a medical facility once transportation available.
Great instructional video. Good luck to the team. Next, let's look at the third group of the day by SAS Viper. Consists of 5 members: Muhammad Syafiq bin Hamzah, Akalili Asikin binti Awaluddin, Muhammad Syafiq Fitri bin Muhammad Tarmizi, Nur Ardini binti Ismail, and Muhammad Rashidi bin Romainur from ILKKM Sultan Azlan Shah, presenting instructional video on first aid or snake bite.
Bring the pain like this. Stop, crank, run 'em, this, stop, crank, run 'em, this, stop, crank, run 'em, get 'em, get 'em, get 'em. Straight till you don't like, whoa, whoa, whoa. Straight till you don't like, Taste that pink venom, taste that pink venom, taste that pink venom, get 'em, get 'em, get 'em.
Weh, benar lah. Ya, kejap. Sini lah. Janganlah jauh-jauh sangat. Aduh! Aduh!
Wait, kenapa? Wait.
Aduh! Aduh!
Wait!
Weh, Izzah! Tolong aku, Izzah!
buat apa ni? Macam mana ni?
Macam tu. Kat sini aku ajar kau cara first aid yang betul. Okay, first kau kena make sure dia jauh daripada ular. Bawa dia tempat yang selamat. Dah, so dah bawa dia tempat ular. Okay, kau selalu tak dalam keadaan macam ni. Okay, kau tenang Tadi ular biasa je, tak ada apa pun ni. Kena takut, okay? Relax, okay? Okay, kena periksa ni. Betul lah ni patokan ular. So, buang semua. Dia punya aksesori. Tengah tu buangkan. Okay, baju ni pun semua kena buang kan? Okay, siapa nak dia saya kat muka dia? Tolong aku tangan ni. Kita kena lap ni kan tisu tak? Ni dia. Okay, so sekarang aku nak tanda masa pakai mikrofon. So, nampak? Okay, Norman. Try kau pegang tangan aku. Okay, tolong tarik balik. Rasa tak? Okay, rasa tak? Sama tak? Okay. Boleh dia sekali? Ada? Okay. Kau tenang Okay. Tolong tarik tangan dia. Okay. Kau tenang Baik. Tolong tarik tangan sikit, angkat sikit. Kau tolong ambil arm sikit. Okay. Kau tolong pegang. Tolong angkat tangan dia. Okay. Okay, done. Aku nak periksa kau kejap. Okay. Check kau genggam. Rasa tak? Okay, sini rasa. Sama tak? Lepas ni, bila korang dah keluar, ni kau tolong bawa dia pergi hospital, kau kapah je. Kau jangan bagi jalan seorang, okay?
Thank you, Team SAS Viper. Excellent instructional video from all three teams. We have 5 more to go. Before that, let us take a short 5 minutes break. See you again. Welcome back, everyone. Let us continue our day with the next instructional video. Let's welcome the next group. The Hamadrayat consists of 4 members: Muhammad Nazrul Shah bin Muhammad Junaid, Aida Nur Sharwini binti Muhammad Shah, Ahmad Kamaluddin bin Rusli, and Muhammad Zulkifli bin Abdul Rahman from Emergency and Trauma Department at IIUM. Instructional video about anti-venom preparation and administration.
Welcome to our REX educational video on preparation and administration of antivenom. Equipments needed for preparation of antivenom are: first, IV drip containing normal saline 0.9% or dextrose 5%. Second, infusion set or IV drip line. Third, antivenom and diluent. Lastly, adrenaline as for standby medications. First step is to open all antivenom and reconstitute freeze-dry antivenom in the diluent. Gently swirl the solution and look at the color of dissolved freeze-dried antivenom. Make sure that there is not much bubble, acceptable color, and no undiluted antivenom. Next step is to syringe out the antivenom. Subsequently, inject the solution into normal saline 0.9% or dextrose 5% bottle and attach to IV drip line. Then, run the antivenom solution about 1 ml per minute for 50 minutes and monitor for any anaphylaxis or allergic reaction. Finish up all the remaining antivenom in less than 1 hour and don't forget to monitor and look for any reaction. Patient must be monitored during and for at least 1 hour after completion of IV infusion. Serially chart the vital signs and clinical progression of the patient.
Great video and all the best to the entire team. Next, we will be looking into instructional video by Educative Indonesia, which consists of 3 members, Dr. Tri Maharani, Bayu Wirawana, and Anjar Kurniawan from Health Policy Agency, Ministry of Health Indonesia, and with the topic of first aid for snake bite.
Aduh. Riko kenapa? Aku digigit ular.
Kalau dilihat dari lukanya, ini tusukan. Jadi pasti ular tadi berbisa.
Aku telepon ambulan ya, supaya Riko cepat dibawa ke puskesmas.
Betul ya. Sambil menunggu ambulan, kita lakukan penanganan awal dengan imobilisasi yuk. Caranya dengan mengapit kaki Riko dengan kayu atau bambu. Intinya, kita buat kaki Riko untuk tidak bergerak. Kemudian ikat menggunakan kain, tali, atau apapun yang kuat pada kayu atau bambu ya. Bukan di tempat gigitan ularnya. Jangan gerakan kakimu, Riko.
Tenang aja, Riko. Imobilisasi berhasil. Sebentar lagi ambulans datang. Kamu jangan khawatir ya.
Wah, kalian hebat. Sudah mengetahui pertolongan pertama akibat gigitan ular. Selama di ambulan, Riko akan mendapat infus pereda nyeri untuk meredakan nyerinya. Sampai di puskesmas, dokter akan segera memeriksa Riko.
Terdapat luka tusuk dan bentuk pinggiran luka yang mulai kehitaman. Dan mata Riko susah dibuka akibat kelumpuhan otot kelopak mata atas karena kena venom neurotoksin. Jadi matanya susah dibuka, tapi tidak mengantuk. Dokter akan memberikan oksigen lewat masker NRBM dan juga memberi rujukan ke rumah sakit untuk mendapatkan anti bisa ular. Gigitan ular di Indonesia adalah kasus yang sangat banyak. Kira-kira 135.000 kasus per tahun terjadi. Cara penanganan awal atau first aid sangat penting untuk bisa menyelamatkan pasien dengan gigitan ular. Imobilisasi adalah penanganan awal yang paling mudah oleh masyarakat awam. Semoga video ini dapat berguna untuk kita semua ya.
Cute video by Educative Indonesia. Good luck, team. Coming up, Group Exotic Animals Teaching Lab, team of 3, Dr. Go Sun Heng, Zal Hasra, and Dr. Tan Li Peng from Exotel, Faculty of Veterinary Medicine, University Malaysia, Kelantan, presenting on first aid for arthropod and stings.
Brown widow spider, Latrodactylus geometricus, is one of the 32 recognized Latrodactyl species. This species is native to southern Africa, but by 1841, the species had successfully established populations in South America and had recently expanded its range to the southern states of North America. This species can be identified by looking at the yellow-orange or red-orange hourglass-shaped streak on the underside of the abdomen. This species is the only known species of arachnids with spherical spiky-shaped egg sacs. In 2015, the first sighting of a brown widow spider was reported in Peninsular Malaysia and has been suspected that this species was accidentally brought in by air. Brown widow spiders are known to be non-aggressive and will only bite when threatened. Their bites are considered mild, but they may lead to severe envenomation similar to black widow bites, with symptoms such as severe pain, cramps, nausea, and vomiting. In 2021, there were 2 reported bite envenomation cases from brown widow spiders in Sabah and Terengganu. Both victims were bitten while trying to wear their motorcycle helmets. The first victim experienced immediate severe pain at the bite site with numbing and burning sensation at the neck and back while having difficulty sleeping due to the pain. On the other hand, the second victim only experienced intense pain. Both cases were successfully treated at the hospital. What happens when you get bitten by a brown widow spider? If by chance you do get bitten, one should expect the following symptoms: a red mark with punctured wound, pain and discomfort around the bite site. What do we need to do if we get bitten by a brown widow spider? 1. Keep the area clean and dry. Wash the affected area with soapy water and pat dry. 2. Apply a cloth-covered ice pack to the bite area. This can help to reduce the swelling. 3. Apply an anti-itch or anti-allergy cream to reduce pain and discomfort from the bite. 4. If the symptoms persist or worsen, to include numbing sensation with pus at the bite area, nausea, and vomiting, please seek medical attention as soon as possible. How do we avoid from getting bitten by a brown widow spider? Here are some places one might find a brown widow spider: garage, gardens, patio furniture, shoes, helmet, and mailboxes. Always inspect and shake out the gloves, boots, shoes, and helmet before putting them on. Clear spider webs in your home using broom or vacuum. If the spider were to fall onto your body, don't smash it. Instead, flick the spider off. This can reduce the risk of the spider injecting venom into your body.
Thank you and great job to all previous groups. Before watching the remaining instructional videos, let us take a short break again. We will see you back in 5 minutes. We still have 4 more instructional videos to go. I hope everyone is still with us. Let us move on to the 7th group of the day. Group Unicorn consists of 3 members: Chia Wei Long, Neo Chai Eng, and Vivian Lim Zilong from University Science Malaysia and Ames University, with instructional video on first aid for snake bite.
You can't actually suck the venom out from snake bites. As a tropical country, Malaysia is home to many ecosystems where snakes play an important role. However, some of these snake species are venomous, posing a medical threat to humans. Venomous snake bites can result in severe health consequences if left untreated, including morbidity and mortality. In this video, we will explore the dangers of venomous snakes in Malaysia and what you should do if you or someone you know is bitten. According to the Malaysian Health Informatics Center, between 2010 to 2014, there were nearly 15,800 snake bite cases reported in the country, with an average of 3 to 4 deaths per year. The states with the highest number of snake bite cases were Kedah and Perak, presumably due to agricultural activities.
If you encounter a snake, it is essential to stay calm and keep a safe distance from it. Approaching a snake aggressively can lead to an increased risk of attack, as they may perceive it as a threat. Avoid making any sudden or provocative movements and refrain from direct contact with the snake to avoid further bites. Seek immediate medical attention by calling 911 or your local emergency number. And while waiting for help, observe the snake from a safe distance to ensure it does not escape from sight. Accurate snake identification is crucial for emergency doctors to administer the correct antivenom. However, identifying the species can be challenging as snakes often slither away, and relying solely on local names can be misleading. One option for identification is to take a photograph of the snake from a safe distance and provide as much information as possible, including the location, date, and time of the bite. Snake bite can be divided into 2 types: dry bites from non-venomous snakes and venomous snake bite. Dry bite generally cause localized swallowing and redness around the bite. Venomous bite can result in a range of symptoms including bruising, nausea, headaches, dizziness, or blurred vision. In severe cases, venomous bite can cause difficulty in breathing or even complete loss of breath, rapid heart rate, weak pulse, low blood pressure, and numbness in the face or limbs.
If you or someone you know is bitten by a snake, it's important to act quickly and calmly while seeking medical help. Move the person beyond striking distance of the snake. Lay or sit them down with the bite below the heart to slow the spread of venom. Keep the person calm and still to prevent the venom from spreading further. Remove any jewelry or tight clothing before swallowing begins. Wash the bite with soap and water and cover it with a clean, dry dressing. If possible, remember to draw a circle around the affected area and mark the time of the bite and the initial reaction. Finally, monitor the person's breathing and heart rate. There are also some misconceptions about snake bites that we should address. Firstly, you should never suck the venom out, as this could cause the venom to spread further and introduce infections. Secondly, the use of a tourniquet was once believed to reduce blood flow to the central circulatory system, but it can actually restrict essential blood flow to the affected area, causing local edema and increasing the venom's effects. Lastly, drinking caffeine or alcohol will speed up the absorption of venom. In conclusion, while snakes are an essential part of Malaysia's ecosystem, it's important to take proper precautions to avoid potentially fatal encounters with venomous snakes.
All the best, Group Unicorn. Next, let's move on to Group number 8, Group 3, with 3 members, Lok Jia Wen, Hong Ket Hong, and Muhammad Adnan Yaakob. All 3 of them are house officers of our very own emergency department of HEP UKM, and topics on anti-venom preparation and administration. Thank you, Group 3, and all the very best. Finally, we are done with all 8 groups. All the very best to all 8 teams. May the best wins. Lastly, I would like to invite all our 3 judges to comment on all previous 8 videos presented. Welcome, judges.
Okay, as we've seen that the teams have done a great job on this instructional video competition. They clearly understood the assignment, and it's also obvious that they put a lot of work into their instructional video competitions. So now we will get comments from each judges for each group. We will start with Pink Venom. Pansaza, can you start it?
Okay, first of all, congratulations to everybody to every team that take part in this competition. I trust all of you have put a great effort from the ideation up to the storylining and until the videoing and also the video editing parts. Okay, so so from me, for the Pink Venom, this is just a humble comment from me. You guys have put on a lot of information there. But to me, the texts are quite lengthy, and maybe you can improve it in terms of use more visual rather than text, and some arrangement can be done to your points, and you should have provided sufficient time for the audience to go through all of your points. That's some points for the improvement from me. Thank you.
Dr. Shukruddin,
Okay,
any
Assalamualaikum.
comments about Pink Venom?
Assalamualaikum and a very good evening. First of all, congratulations to the Pink Venom, is it? It seems that they divided parts of the videos among their team members. It's a good team effort. However, the final product will be a bit can we say can be confusing, because there are multiple background, multiple selection of text, which is not standardized or throughout the whole video. Even though it's only 3 minutes and 7 seconds video, there are a variety of background color and font types chosen for the video. And also the time given for the audience to read through the information that was displayed on the screen is too short. I calculated in one screen there's 70 sentences, 5 images, and only given 4 seconds for the audience to digest all the information. So it's quite a busy, if you put it in slides, it's very busy slides that the audience cannot grasp what the author is trying to tell the audience. So in presenting instructional video like this, you should concentrate on giving small chunks of information to the audience to follow, so that they can understand and understand what the author is trying to, the information that is trying to be relayed to the audience. And also there's, I noticed there's some still wrong terminology in the video, the usage of the poisonous sentence. So when describing snakes, we prefer to use the word venomous, not poisonous. And also there's some error in the video, which is in the physical base symptoms. In the pit viper bites, the explanation seems more like of neurotoxic snake bite physical symptoms. And also in the video of do not raise the wound above the level of the heart, the video inserted is a person is putting a tourniquet to the arms, which is not relevant to the explanation given. And also lastly, some of the content is repetition of some of the treatment, which is the don'ts. There are some repetitions, such as the cutting, the sucking. There's a repetition of the slides, the video contents. So that's my comment. Thank you.
can we have Dr. Patrick to comment about pink venom?
Yeah, thank you very much for pink venom for that wonderful video. So same as the comments of the other judges, I think there's too much information that needs to be taken in by the audience. But since the videos are too fast to be absorbed and there are too much information in one slide, the audience cannot fully understand the meaning or the message being brought by the team. So I commend maybe in the process of making the video, they have the white background and the fonts are, some of the fonts are not that readable. So maybe you can probably shorten some of the messages in the slides, and but it's fully informative. And as mentioned by Dr. Saleh, is some of the parts have wrong have a wrong misunderstanding, like the poisonous part and the way how you do the first aid. That's all. Thank you.
Thank you, Dr. Patrick. Moving to the next, maybe our advisors, Dr. Prof. Khaldun, got any advice or maybe compliment for our pink venom?
No, I'm not the judge, but I think I would have to congratulate all the judges for having a tough job in judging each one of these videos. Very interesting, I think. And I think the points made by the judges for the first group is, I think, spot on. A few things on terminology and also some of these maybe misunderstanding of facts. So anyway, let's move on, perhaps.
Move on to the next group, the warrior. Can I have Puan Sazaroni to comment on the warrior group, please?
Okay, for the warrior, again, I want to congratulate this team. From me, I think there are important points that these team members can address it in more attractive way rather than just put on in sentences. And there are a few things you can highlight, especially the activities related where the public or the people can expose to this jellyfish sting. You know, what are the things, what are the activities that most people engage with that will expose them to this jellyfish, venomous jellyfish sting. Yeah, that's from me. Thank you.
Thank you so much, Puan Saza. Dr. Patrick, what about you?
Yeah, thank you for the team for a wonderful presentation. So I just have some comments regarding maybe the sequencing of the do's and don'ts. There was, if you were the audience, will be having misunderstanding on what are the do's and don'ts, especially when they put there the X mark, the red mark. So maybe emphasizing that the following sequence are the do's and the following sequence are the don'ts, so that the audience will not be confused on this. Thank you. That's all.
Okay, from me, overall the video is very good because it is a clear, well-paced video, easy to be followed by the audience with a good narration. However, some improvement that can be made. In the video, it shows that do not remove tentacle by mouth, which is unlikely to be done by anyone when managing jellyfish sting. So instead of that, they should have highlighted what were more commonly done, such as using rinsing it with fresh water, using sands to remove the tentacle, or using bare hand. So it should be highlighted more on that. and removing using forceps. Actually, for first aid, it's unlikely that we use forceps in the event of jellyfish envenomation. So what's more practical is by using cloth or, if available, gloves to remove the tentacle after dousing the remaining tentacles with vinegar. And for the video of using vinegar, it's good to use the actual bottle of vinegar instead of the large bottle, which is mainly used in a hospital setting. I think that's all.
Thank you, Doctor. So maybe next we can have comments or compliment for SAS Viper. We will start from Dr. Patrick. Please, Doctor.
Yeah. Thank you for the team SAS Vipers. So very interesting because they, unlike the other teams, they use like situations, and they really like actors and actresses on the video. So I commend them for doing this. It's hard to be an actor in such a in video. So maybe one comment would be there's a part there where they put the tape on the bite site and then place the bandage. So I think it should be done in a facility so that we can properly monitor the progress of the swelling. So maybe more on understanding the steps on how to do the first aid on this. But otherwise, I think they did well on emphasizing the steps on how to do the first aid on snake bites.
Thank you, Dr. Patrick. Dr. Shukruddin, what about you?
Okay, so congratulations to the team. Very nice video with good acting and very good dramatization of the events. However, the conversation is in Malay, so I think Dr. Patrick will have some difficulty in following the chronology and the scenario because the information is for Malay audience. Very nice movie. It seems like watching a professional movie. Okay, just a few comments regarding the usage of compression, bandaging, immobilization. The scenario is seems likely like a pit viper bite because the snake is located on the tree. So it is not advisable to use PBI for pit viper bite. It is mainly recommended for Malaysian setting. It is recommended for crates or sea snake bite. So for pit viper and elapids, for our elapids, for pit viper and cobra, pit viper and cobra, PBI is not recommended. So selection of the scene should be carefully selected. I think that's all. Hopefully everybody can hear my comment.
Yes.
Okay, so the connection is better.
It doesn't. That movie doesn't have a subtitle. If the subtitle in English, I think should be okay, right?
Yeah. I'm thinking so too, because it is a great video, but it just the subtitles, isn't it?
Yeah.
Okay, what about we moving to the next group? That is
Ponsaza
Hamadiyah.
already comment? Ponsaza already comment?
Ponsaza's.
Okay.
Okay. For the SAS video overall, this group has shown great teamwork. Okay, I like the video with the drama in real situations, whereby I think when you video the scene, maybe some of the point you can add into your storylining is taking photos about the species that involve. Maybe that will be beneficial for the doctor to do the further management for the patient. Not much to comment for SAS video. Overall, you guys have done a great job. So thank you.
Thank you, Ponsaza. Next, we will be commenting the Hamadiyah. Can we have Dr. Ponsaza once more?
Frankly, I don't have much to comment on Hamad Riyad groups, because to me this is a very professional kind of video. It has its own category, so not much comment from me. I think I'm happy with the video.
Thank you, Ponsaza. Can we hear from Dr. Shukruddin?
Okay, for the fourth group, excellent video, instructional video regarding antivenom preparation with a clear instruction, clear caption, and well-paced flow of information to the audience. Things only minor improvement can be done. There's some duration of silence during the doctor is preparing, syringing out the water for dilution. So with a bit more of editing, you can shorten the scene so that you reduce the silence portion of the video. But overall, it's excellent video for teaching how to prepare antivenom for patients. Thank you.
Thank you, Dr. Shuk. Dr. Patrick?
Yes, thank you very much for the team for a very clear video on how to prepare or administer the antivenom. So as mentioned by the two judges as well, this very clear video and a very good example of it's like teaching how to cook a dish. So it's a point by point description of how to administer and prepare the antivenom.
Just one comment from me regarding this is also important that maybe need to specify for which country this video is intended to. Perhaps this is maybe referring to the Malaysian scenario of preparing the antivenom, because different country may have different antivenoms, and therefore the way they prepare also could be different. Just to bear that in mind.
Will do, Prof. Karl. Thank you for the advice. Next, we will be moving to the one and only. Our participants from Indonesia, Educative Indonesia, group number 5. Can we have Dr. Shukruddin to come in?
Okay. Very entertaining video from Educative Indonesia. It is in Bahasa Indonesia with good caption in English. Just a few comments regarding that, because in the video is mentioned regarding identification of a venomous bite by tusukan or puncture. We should be careful, because in great species snake bite, sometimes we can barely find the puncture or the tusukan in of the wound. So it is still considered as a venomous bite, even though there is not much of a local effect to the bitten limb. Secondly is the video is highlighting about immobilization. So it consume part of the video regarding emphasize on immobilization. It will be better if other information was also given to the audience regarding what was not done for snake bite, which is in I think in everywhere in the world we have a common misconception of snake bite management, such as sucking, putting a tourniquet. So we should take the opportunity also to highlight on the what should not be done to the bitten limb. Another thing is in the video, there's medical terminology was mentioned, which is the masker NRBM. I think is refers to the non-rebreathing mask, which is looking at the video, it seems that it is targeted to public, but to the public. So we should try to avoid using medical terminology for public video contents. However, it's a clear, easy to understand and entertaining video to be watched. Okay, thank you.
Thank you so much, Dr. Chukwudi. Dr. Patrick?
Yeah, thank you very much for that video from Indonesia. I think it's entertaining videos specifically for children, and it would be better if in the first part there will be some English translation so that people from other countries would be able to understand. But on the latter part, I think they put some translation at the end. Based on the other judges' comments as well, so it emphasizes on immobilization. So I think the team were thinking of taking into account a concept from the first aid that is needed in their country. So I respect them if they just emphasize on that. But of course, it would be better to have a holistic approach on the first aid as well. So taking into consideration the do's and don'ts, so that the audience would be able to know the proper first aid and the don'ts that should not be done in these cases. So other than that, I think it's entertaining as well, and kudos for the graphics, because it's like a cartoon-like video that is very, detailed as well. Thank you very much.
Thank you, Dr. Patrick. Now we can go to Pansaza.
Okay, thank you. Like other two judges, I agree. This video is very enlightening. I think I want to share it with my children. But even so, I'm happy with the software you use. Describe it. You portray all the information in cartoon way. It's very entertaining, but I'm confused. Who are your target audience? If for children, we understand that children are not able to do many things, okay? But if you want to address it, if you are targeting adults or maybe public, then the do's and the don'ts, like what Dr. Patrick has mentioned, apply. So yeah, I don't really know how to put my points here, but overall, in terms of presentation, yeah, you guys have done good job. But in terms of the point, I think many things we can look into it. Yeah, thank you.
Anything to add on, Prof. Kang?
No, I'm okay. Just continue.
Okay, we proceed to the group from Exotic Teaching Lab, if I'm not mistaken, or it's called Exoto. So can we have Dr. Patrick to comment first?
Yeah, thank you very much for a very nice video of, I think it's special as well because this one is unique from the others. We rarely see some first aid for spider bites. So they have a thorough history of how the spiders were migrated to other countries and mention some history of it and cases. I think they did well. They were concise in specifically addressing the first aid. Although I would have probably, in terms of entertainment value, probably would have more creative in such way. Thank you.
Thank you, Dr. Patrick. Next up is Pontaza.
Okay. As for the Exotel, the topic you chose is about first aid for arthropod bites or sting. But in your video, you just highlight a species of spider, which I think you can address or elaborate further a little about arthropod groups, what they are, what they, what are the insects or the arthropods that involved. And as for the do and the don'ts, yeah, I'm happy with the points you have addressed. Your points, you have put it in an organized way, very clear. And yeah, congratulations. Thank you.
Thank you, Pontaza. Dr. Shuk.
Okay, congratulations to Exotel team. Very entertaining video with excellent usage of multimedia content, especially relevant videos relevant to the information conveyed to the audience. Seems like assisted by artificial intelligence in production of this video. So it's the in thing nowadays. However, the targeted the content is what we are rarely see in Malaysia. It's interesting topic. However, as mentioned by other judges, it will be much better if it also includes other broad groups of approach of management for arthropod bite and stings. I think that's all for my comments. Thank you.
Thank you, Doctor. Last but not least, we have Unicorn, Group Unicorn. So can we have Dr. Shukruddin again to comment on Unicorn team or compliment them?
Okay, for the Unicorn group, congratulations for a clear instructional video, clear narration. However, the first statement in the video regarding sucking the venom from snake bite is a bit confusing because it just hanging in the introduction of the video. But my concern is in the video, it's highlighted regarding when they mention about the snake basis, poisonous versus another terminology of poisonous versus venomous is also misleading. And also the differentiation between dry bite and venomous bite actually is we must be very careful when the mentioning regarding dry bites or venomous bite based on the wound of the patient, because as we know, spectrum of injury caused by snake bite, you have snakes with a minimal local effect, such as the crates and sea snakes, which is barely can have any puncture seen or no swelling, does not cause much of pain, but it causes paralytic effect later on. And also another thing is regarding advice given. To draw a circle on the affected area, it is not recommended in monitoring or managing snake bite wound. Usually we advise for rate of proximal propagation monitoring, just use a thin micropore and a label on the border of the swelling of the wound. I think that's all.
Thank you, Doctor. Next, can we have Dr. Patrick for Unicorn team?
Okay, thank you very much for Unicorn team. So I think they did well in the entertainment part of the video. A very nice sequencing. And I think the teamwork is there because there were different voiceovers in different parts of the video. So as mentioned by Dr. Shukredin, there's probable misunderstanding on the encircling the part or the placing a mark on the beaten side. So probably they would have mentioned it, they should have not mentioned it in the video so that the people would not, do it in the pre-hospital. Other than that, I think I was entertained with that, with their video. Thank you very much.
Thank you, Dr. Patrick. Next up is Ponsaza.
Okay, I agree with Dr. Shukruddin about the first sentence that you want to attract or gain attention from the audience. Why about, you highlight about sucking? Why? There are many other things you can put in your introduction. The rest, besides the statement, I think you guys have put all your contents, all your points beautifully. You arrange it nicely and very clear, and you put the subtitles easy to grab all your important points. So that's all from me. Well done, Unicorn team. Thank you.
Thank you, Ponsaza. Last team. We got our teams from UKM itself, team 3. So can we have comments from Dr. Shukruddin? Regarding team 3?
Sorry, forgot to unmute.
Nah, it's okay, Doctor.
Okay, for the last group, very good video, except it do not have a narration explaining regarding the contents of the video. However, it was made as such with a great tempo so that the audience can slowly digest or read the information that was displayed on the screen with ample time. So the information can be gathered by the audience quite good, even though where there's no narration, because of the speed of info display is good with good animation. I think that's all, not much of comment for the last group. Thank you.
Thank you, Dr. Shukruddin. Can we have Ponsaza next?
Okay, as for the group 3, I think you have many information you want to put in your presentation. You use very interesting, what do we call, format, the Powtoons to address your points. But I think you can more towards the presentation, the arrangement of the points and the screen, and that's all, because it looks quite cramped with the informations. Although the tempo is good, unfortunately you don't have the narration. I think with the narration it can improve a lot in terms of your presentation, the presentation you have demonstrate to us. Other than that, I think not much to comment. Yeah, well done again to Group 3. Thank you.
Thank you, Ponzaza. Can we have Dr. Patrick?
Yeah, thank you very much for Group 8 for that wonderful presentation. It's unfortunate because there are two groups who presented regarding anti-venom preparation. So you have more or less have to compare them. Of course, the other one had an actor in it, and this one has more on the text. So most probably, the value of the having someone to narrate on the topic or on the contents of your slides would have been much appreciated. And of course, I think you had a different attack on the way how you explained the preparation. But of course, maybe for me, I would have preferred a person acting on it so that I would be much entertained and more actively viewing rather than reading the slides. That's all. Thank you very much.
Thank you, Dr. Patrick. Prof. Carlos, anything to add? Maybe to cheer up our
No, I think
today?
yeah, I think the judges did a good job in giving very, very good feedback, and I think each team should take the comments and pointers, to perhaps improve their videos before it can be utilized. Otherwise, you'll be disseminating wrong information and so on. So anyway, congratulations again to all judges and all teams. So we wait for the results. Am I right?
Yes, you are going to
Okay.
have 5 minutes break so that our secretariat can do some calculating in marks and whatsoever. So 5 minutes break, guys.
Okay.
Thank you, judges. Thank you, Prof. I have some question. Is there any hint of what we could win from this?
I have few favorites, but I don't want to be biased. So, which one was your favorite?
My favorites, I like few teams though.
I like the cartoon one. It was very cute.
The educative one, isn't it?
Yes, educative.
But I think all videos is quite
informative and
interactive.
Yes.
So while waiting for media teams to do their technical issues, should we give some hint of what they might win?
Okay, should we ask Prof. Carl who he thinks will win?
No.
Oh.
Too biased. No, I better not. I better not say anything about who wins or not. It depends on our judges. So we put our trust in our expert judges' decision. So we will just wait for that.
All right. So before we move on to the winner announcement session, I would like to briefly tell about the cash prize that we'll be taking back home. The winners will be taking back home. So there will be 3 finalists as per said previously for the winners that we will be announcing in a while. The first prize will be receiving 500 ringgit Malaysia. The second place will be receiving 350 ringgit Malaysia. And the third place will be receiving a total of 250 ringgit Malaysia. And we also have consolation prizes for those who came in 4th and 5th. All right. So let's just wait another 2 to 3 minutes. I hope you guys could bear with us. We are really sorry for the inconvenience caused. Okay, so we are here. The time is here. Without wasting any more time, I would like to announce the winners for today's Instructional Video Competition 2.0 2023. Starting from the 3rd place, please give a round of applause to group Exotic Animals Teaching Lab from Exotel. Congratulations, guys. You can take a screenshot for your winning moments. All right, so moving on to the 2nd place, please give a round of applause to Hamadrayat from Emergency Instrument Department at IIUM. Congratulations. Okay, and the winner of Instructional Video Competition 2.0 2023 is Team SAS Viper from IILKKM, Sultan Azlan Shah. Congratulations, Group SAS Viper from IILKKM, Sultan Azlan Shah. You guys got this. It was a great video. It was super fun with the Pink Venom songs and all. It was super entertaining. And the actors, the lifesaver was super cool. Okay, so let's move on to the consolation prize. For 2 groups for IVC, they will be receiving a total amount, which is for Team Sri and Team Warrior. Congratulations, Team Sri and Team Warrior. You guys did a good job. And for the rest of the team, you guys did a great job. It was just a super tight competition. It was tough to determine the competitors, the winners and all. All right, before ending the session, I would like to welcome our program advisor, Prof. Carl, for closing remarks.
Okay, thank you so much. First of all, I would like to say congratulations to all winners. I think everybody here is a winner. All the teams had really put in quite an effort to really showcase their skills, their passion in the videos that they produce. What I would like to congratulate also is the team that our secretariat that has been running this program for the past, I think, a few months, and also following what they have experienced in the past year. So this is our 2nd instructional video that we decided to open for international participation. So this is a good step, a good evolutionary progression to what we just start as a for one class. Now it has evolved with international participation. So hopefully IVC 3.0 will be even more successful than today. So with that, I would like to say also thank you to our esteemed judges who had very tough time deciding on the points. But I would like to also encourage each team to go back and perhaps contact our secretariat for all the comments that the judges have given and written down for their team, so that they can actually improve and make or re-edit their videos so that it can be much better before it can be actually used for teaching purposes. So the ones that you submitted today is purely for competition purpose, not to be used for mass teaching. But if you take note of the points given by the judges and re-edit your videos and revalidate it again by the experts, perhaps it can be used for teaching and learning purposes. So I congratulate everyone. All the best. I would like to say also thank you to all of our collaborators Persiap particularly, who spearhead this program. So I hope to meet you all again in the next IVC 3.0. With that, I thank you.